What I'd like to cover today is the complexity of post-concussion syndrome. Essentially, there's three main components that can occur when you have post-concussion syndrome. And the first is damage in the physiological category, which essentially means damage to the cell wall of the neurons in the brain. And what results from this is the leakage of calcium back into the cell, which affects a structure called the mitochondria. The mitochondria is responsible for generally producing energy for an individual. So this particular type of issue is combined with a significant amount of fatigue, not to mention headaches and poor concentration, etc. The second component is what's known as the vestibulo-ocular component, and this involves damage to the oculomotor function of the eyes and the movement ability to accommodate, follow a target, maintain gaze, etc., as well as the balance system. This particular type of component we can measure quantitatively with advanced technology that we have, such as saccadimetry, video nystagmography, as well as computerized posturography. This particular component also has an issue with headaches as one of the symptoms, but as well, individuals with damage in this category have difficulty with movement, driving in a car, walking through a mall or grocery store. A lot of confusing issues with sensory input from their visual or balance system is very, very common here. The third component is what's known as the cervicogenic component. And in many cases, individuals that have hurt their head will also have concurrent neck pain. And if there's any issues with the neck underneath the base of the skull, this can also contribute to headaches as well as difficulty with turning the neck and sometimes tracking objects with an eye-head strategy. It's really, really important to understand that in order to get the best outcome from treating this very complex case, you want to make sure that you're dealing with all three of these conditions at the same time. And our clinic is uniquely positioned in order to do that.